Did you finally get cleared for sex after your baby and only discover that it hurts? You're not alone. One of the biggest postpartum myths is that everything magically goes back to normal after your 6 week visit. In reality, many patients experience pain with intercourse for months or even years after childbirth. Today, I'm going to explain why sex can hurt, what's normal, what's not, and most importantly, what you can do about it. I'm Dr. Jessica Poulin, a physician and founder of Vital Femme MD, where we help women recover after pregnancy and beyond. Let's talk about it. First, I want you to know something really important. Painful sex after baby is common, but it's not something you just have to live with. Studies suggest that a significant percentage of women experience pain with intercourse during the first year after having the baby. And the reasons are often very different from what you might expect. Many women assume that if they had a tear or stitches, that's the entire explanation, and sometimes that is true, but other factors can also work together to contribute to this. Think of postpartum recovery like recovering from a marathon, surgery, hormonal shift, and sleep deprivation all at the same time. Your body is healing. Number one, estrogen. The most common cause of some of these things is low estrogen. After delivery, estrogen levels drop dramatically. If you're breastfeeding, estrogen often stays low for months. Estrogen is really important. It helps maintain the healthy moisture within your vaginal tissue as well as natural lubrication during sex. Without enough estrogen, the vaginal tissues can become dry, thin, sensitive, and more prone to irritation. Many women describe intercourse as it feels like sandpaper or it feels like I'm tearing. If that sounds familiar, hormones may be playing a major role. Number two is tension. This one surprises many women. We often hear about a weak pelvic floor after birth, but sometimes the problem isn't just pelvic floor weakness, it's actually tension. Imagine clenching your jaw all day. Even those muscles can become tight and painful. The pelvic floor can do the same thing. After pregnancy, delivery, trauma, tearing, and even the fear of pain, those muscles can remain guarded and tight. And then this guarded and tightness can cause pain with penetration, burning, deep pelvic pain, difficulty relaxing while you're having sex, and in many cases, pelvic floor therapy can be incredibly helpful. So if you've had a tear, a episiotomy, which is when they cut you, a cesarean section, scar tissue, many of these things can contribute to your discomfort. Scar tissue can be less flexible than surrounding tissue. Sometimes women may notice pain in a very specific spot, and others may describe a pulling sensation. The good news is that scar tissue often improves with targeted treatment over time. The third thing is overwhelm. Here's something that I don't think is discussed enough. Your body and your brain are connected, and if you're exhausted, overwhelmed, touched out, sleep deprived, and caring for your newborn, your body may just not feel ready for intimacy. That's okay. Many women think that something is wrong with them because their libido is lower, and often it's just a completely normal response to the enormous demands of being a mom. Recovery involves more than just healing your tissues. It involves healing the whole woman. So what is normal versus what is abnormal? Some mild discomfort during the first few attempts at intercourse can be very common. These symptoms, though, however, below deserve evaluation. Severe pain that continues for months, bleeding after intercourse, burning that does not improve, pain preventing intimacy, urinary or bladder symptoms, pelvic pressure or bulging. You simply don't need to just push through. Pain is actually information, and your body is telling you something needs attention. So what can you actually do? If sex hurts after having a baby, here are a few things you can try at home. Number one, a high quality lubricant. Two, take things slowly and communicate openly with your partner. Number three, ask your healthcare provider whether hormonal changes may be contributing. 4, consider pelvic floor therapy. And number 5, get evaluated if symptoms persist. At Vital Femme MD, one of the things I focus on is helping women understand the root causes of your postpartum symptoms instead of just assuming that they're a part of motherhood that you have to accept. Pain with intimacy is common, but it should not be something that you're expected to endure forever. If you've been experiencing and struggling with painful sex after baby, I hope this video reassures you that you're not alone and that help is available. Recovery after pregnancy is more than just surviving. It's about restoring and transforming your health, your confidence, and your quality of life in this next phase. If you found this video helpful, please like, subscribe, and share it with another mom who might need to hear this message. And tell me in the comments, how long postpartum are you, and what's been your biggest surprise after having your baby? Take care of yourself, mama. I'll see you in the next video.